evening, friends. I am Shrenik from Ahmedabad, and having commendable pleasure and privilege being a patient ambassador of Indian Cancer Society with additional assignment to moderate uh, live webinars under the title of Fridays with Shrenik. And until now, we have successfully done 5 webinars, and today we have a very handsome, competent, young, and quite experienced DNA cancer surgeon, Dr. Nitin Sharma. And until now, we have done the sessions with the oncologists. They went into conventional surgery or radiation therapy. Today we have Dr. Nitin Sharma, and he will be sharing his knowledge, expertise about robotic cancer surgery, robotic surgery for head and neck cancer, which helps in reducing the scar and quite deep-rooted surgery. Dr. Nitin, welcome on board, and stage is all yours.
Thank you, Shrenik bhai, for your kind introduction. So, we have been known to each other for last 10 years, na? If I'm not wrong.
Yes, sir.
And I have seen you lively, enthusiastic, and just keep it up. And thank you so much for inviting me here.
Thank you. Sir, you can now continue your talk about robotic kidney cancer surgery.
So, first of all, there are certain myths about robotic surgeries. So, uh, sometimes patient ask me, what does it mean? What is the robotic surgery? What is the role of robot in any surgery? So I usually tell them the robot is just an instrument, but it is very advanced instrument. So what actually happens is robot is not doing your surgery. Your surgery is being done by your surgeon only. But robot is the most, it is a pinnacle of science. So it has great dexterity, great visualization, precision. So the outcome of surgery increases when we use robot in any form of surgery. So this is in nutshell, this is robotic surgery. The robot doesn't do the surgery, your surgeon does the surgery, but the quality and outcome of the surgery is fantastic with this wonderful instrument. So this is robotic surgery. And first robotic surgery was done in 1985, way back. Can you imagine 1985? First stereotactic brain biopsy was done in US, and that was experimental thing at that time by US Armed Force. Then the many stepwise manner, many development came, and FDA approval was given in 2000. And in 2005, first robotic head and neck surgery was done. So this is the history of robot. So since 2005, 20 years. So in past 20 years, robotic head and neck surgery has seen many landmarks. Now we are doing so many surgeries which were not there before the commencement of robotic surgery. So robot has changes. It is like game changer in head and neck surgery, and there is way to go. So right now we are doing 3 types of head and neck surgery with the robot. The first thing is, you heard about thyroid surgeries. We all know there is a gland in the neck which is thyroid gland. So robotics, usually we do thyroid surgery with open approach. So what happens in open approach? We have scar. Patient has स्कार एट मिडलाइन, नेक में बीच में स्कार होता है. बट इफ यू डू सर्जरी विद द रोबोट, you can hide that scar. Now it is very simple thing. What is the importance of scar? So scar की जो importance है हमें तब पता चलती है when you have patient, young 25-year-old girl in your OPD, and she's having thyroid disease or thyroid nodule, and she's she's going to marry in next 1 year. So if you have another patient like a banker, 35-year-old male banker, his job is to cater the day-to-day customers, and he is very lively, he has social life, and he come to your OPD with a nodule, thyroid nodule. Obviously these type of patient demands that there shouldn't be any scar after surgery, because a scar tells them that they had disease. So every patient now wants that there shouldn't be any scar of post-operative scar after the surgery. So with the robot, we can hide that scar. This is one advantage. The other advantage is oropharyngeal surgeries. If you go back to the history, 20, 30 years back, we don't have any surgeries for oropharynx. The oropharynx is a part of oral cavity which lies behind the tongue. So access to that part is very difficult. 20, 30 years back. I'm talking about 20, 30 years back. So at that time, for those cases, we have only one option left, that is radiation or chemoradiation. But after advent of robot, now we can do surgery, very good surgery for the oropharyngeal cancers, and the outcome is excellent. So this is second area. So one is thyroid, second is oropharynx. Third one is parathyroid. So parathyroid is again a very small gland located just near to thyroid. And for any adenoma, parathyroid adenoma, or any other parathyroid disease, we can use robot. And in the same way, we can hide the scar. Fourth one is robotic neck dissection and free flaps. So this is something, a new concept came. So in this thing, what we do cancer surgeries with the help of robot. And again, we are able to hide the scar at the patient's face or neck with free flaps. So there are, right now we have 4 indications for robotic head and neck surgery. And in all 4, we can hide the scar. We can give very good cosmetic results to the patient, and the patients are really very satisfied. Shrenik sir?
Yeah, sir, please let us know much more about the outcomes, positive outcomes of robotic surgery against conventional or open surgery. Our audience would be much more interested in learning from you as an expert robotic surgeon. That I mean, if someone has to approach a cancer surgeon, and if the patient is given two choices of the open surgery and robotic, please explain with more into details, like so that it will be easier for the patient, and not only patient but even for caregivers to what is required, or rather what is more important and beneficial for the patient, uh, opting for a normal open surgery or a robotic surgery.
So the first and foremost is cosmesis. Cosmesis and scar is the biggest advantage of robotic surgeries. First thing, because these days cancer, thyroid cancer, or oral cancer is not remain to the older people. Now we see the patient who are young, energetic, socially active. They have their family life, they have their social life, they have their partners, love life. So they want to enjoy the life. And when these types of patients come to you, they have a specific requirement that they want to preserve their beauty, they want to preserve their cosmesis, functional as well as aesthetic. So in those cases, robotic surgery is very helpful. Right now, what we are doing, we avoid the visible scar over the neck, and from the same scar, we do the free flaps like fibula. What is fibula? Fibula is the replacement of jaw bone with the bone from the foot. So can you imagine a person comes to you with a cancer in oral cavity, which involves the jaw bone, and we remove the jaw bone, replace it with the fibula, another bone from the foot, without leaving a scar, visible scar. I'm not saying scar is not there. Scar is there, but the scar can be hidden in hairline. So post-operatively, you cannot say that this patient is operated. So his social life, his family life is exactly same as before. So this is the biggest advantage. One of my patient, I tell you the story. So 6 months back, I had a patient. He was a shopkeeper, and his daughter is in medical sciences. She is doing nursing at some college at Ahmedabad. So they came to me. Mm, that person has cancer of right lower jaw. They came to me. I explained them, and they went back. After a 1 month, after 15 days, not a 1 month exactly, after 15 days, I received call from his daughter, and she was saying we will go with the robotic surgery. Then I asked why, what is the reason why you came back? So she told me, I want my father to look exactly same after the surgery as he is right now. And I asked why. So she told me, my father is a very active social person. First thing, he is shopkeeper. If you put a scar on his face, his confidence will go down, and he will be he never will be the same. And that is why she came to me. We have operated him, and right now he is absolutely fantastic. He's doing his job wonderfully. I tell you one
Nice.
more story. So I had one patient. She was operated first. She was operated for left side oral cancer in 2012. So that time robotics and all was not available, and she had big scar over left side of the neck. Again, she developed right side small lesion at right side, right buccal mucosa, and this time she came to me. And she specifically told me, I don't want this type of scar. Then I gave her an option of robotic surgery. Family happily accepted that. We have operated upon her, and right now she has passed 3 months, and you can appreciate she has scar on left side but no scar on right side, and she is happy. So these are few stories which shows the importance of scar.
Yeah.
If you
So
don't give them scar, if you give them functional outcome, good functional outcomes, if they able to swallow well, if they able to maintain their cosmesis well, they are very grateful to you. And this is the biggest advantage of robotic surgery. The second thing is, since visualization is very good with the robotic camera, so you can see the details, every single details. You can preserve nerves very well. You can tackle the vessels very well. So the outcome is very good. This is the second advantage. And the third advantage, as I told you, the oropharyngeal surgery. The oropharyngeal surgery was not there before robotics, because no one can reach. the posterior part. Posterior means deepest part of the neck. So right now we are able to do those surgeries. I tell you one more story. A lady, she was 65-year-old lady, and she has a lump in posterior part of the mouth. मतलब जहां पे हमारा पैलेट होता है वहां पे उनको था, एंड शी वेंट टू सम हॉस्पिटल इन मुंबई, एंड उन्होंने उनको बताया कि हमें आपका मैंडिबल, सो दे टोल्ड मी वी हैव टू स्प्लिट योर मैंडिबल फ्रॉम हियर, जॉ बोन फ्रॉम हियर, एंड देन टेक द एंटायर ट्यूमर आउट, हम वापस से लगा देंगे पर ऐसा होगा. तो शी रिफ्यूज्ड. शी केम बैक टू मी एंड शी वाज वेरी अप्रहेंसिव कि हमें सर्जरी नहीं करवाना है क्योंकि तो बहुत बड़ा होगा. तो वी टोल्ड हर, माता जी कुछ नहीं होगा, हम मुंह से ही उसको निकाल देंगे, आपको कहीं चीरा भी नहीं आएगा, आपको पता भी नहीं चले, 4 दिन में तो आप घर चले जाना. एंड वी डिड दैट सर्जरी विद अ रोबोट. यू वोंट बिलीव सर, fifth day patient was perfectly all right, eating everything, and right now she's happy with the outcome of the surgery. So these are the advantages.
Sir, I must admire, and I am quite impressed with the explanation you have given, and let's not forget whether it is male or female. You know,
Exactly.
everybody is concerned about the law, about the scar, and nowadays a
Exactly.
lot of socially engaged. So, when there is a scar, people will, look at the person differently. And when there is no scar, people will look at differently. Now, sir, there is one question from one of the audience, like what is the overall cost of robotic surgery as against the conventional or open surgery?
No, no, it is not very much high. So at our center at HCG, so we additional cost of adding robot to any surgery is 80,000 to 1 lakh only. Just
Right.
80,000 to 1 lakh. So it is not very costly issue.
Yeah, I agree. And sir, tell us more about the recovery part. I mean, as against open or conventional surgery, if the robotic surgery is done, the discharge and recovery part is better than the conventional or not.
Recovery is all same because it depends upon the what surgery you are doing. If you are doing oropharyngeal surgery, definitely recovery is faster. If you are doing free flaps, the recovery time is same. But after recovery results are excellent. And we
Right.
all are evolving. This branch is evolving. So, Shrenik sir, after 10, 12 or 20 years, single port will be available in India. Within 4 5 years, single port is already there. So with a single port, you can do very small surgeries with very small scar. So then the recovery will be like anything, speedy like anything. But right now, the time of recovery is same, but the after recovery results are fantastic.
Sir, please explain a bit more into detail about the single port.
So right now we have robots with 4 arms. So you can assume जैसे ये मेरी 4 उंगलियां हैं, तो रोबोट की 4 आर्म होती हैं. So for 4 arms, we need to create 4 holes in the body. So they take bigger space. अब imagine everything you can do with a single finger. So single port is available, but right now not available in India. So once the single port will come, you can go anywhere from very small hole. आप एक छोटे मुंह में अभी क्या होता है कि we need bigger mouth opening for to do robotic surgeries. We need to create bigger space. Then the requirement of space will be very small, and then you will see the miracles. It will go to nose, nasal surgeries will be possible. Laryngeal surgeries, right now also we are doing laryngeal surgeries, but laryngeal surgeries will be very easily being done. So we have way to go. This technology has changed the medical sciences like anything, and these changes will remain, and we
Sir,
will see.
yeah, sir. I mean, I'm quite happy to know that the digital cancer can be done through robot, because I mean I underwent the total
Yes, yes, I can
one
understand.
from left to right
So
and
I
all that.
Shrenik bhai, I tell you one more story. Then you will realize the importance of these type of surgeries.
Yes, sir.
So
Please.
recently, I have operated a boy, so who is 28 years of age. Unfortunately, he developed cancer of tongue. You can imagine a boy of 28 years just started his job, marriage fixed, and he just diagnosed with the cancer tongue. So they came to me, and the only thing कि sir ठीक हो जाएगा. I said yes, obviously ठीक हो जाएगा. मेरा चेहरा कैसा रहेगा ऑपरेशन के बाद. And in that particular case, bilateral neck dissection was indicated. मतलब दोनों तरफ गर्दनों में से गांठ निकालनी है आपको, उसकी टंग को फ्री फ्लैप. You need to make his tongue with free flap. You need to preserve his voice. You need to preserve his face, and without putting any scar over face, because he is going to marry. उसकी अभी शादी होगी. पूरा एक बड़ा इवेंट है. लाइफ मैरिज एज यू नो इज अ लाइफ टाइम इवेंट. So we did robotic surgeries, bilateral neck dissection. We created. Uh, I am blessed. My plastic surgeon, Dr. Dhanush, is very enthusiastic and very energetic and very talented. So we did bilateral robotic neck dissection. Bilateral का मतलब हमने दोनों तरफ से रोबोट से उसकी गर्दन की गांठें निकाली, उनकी टंग का कैंसर निकाला, and with the same incision we gave him. We did plastic surgery, and right now he is absolutely fine. Hopefully उनकी मैरिज है 6-7 महीने के बाद, and we wish him very good life. But कई बार these instruments are like blessings,
Yes,
and the
absolutely.
biggest part is, a good part is, I must say, we can, जब पेशेंट के चेहरे पे स्माइल आती है ना कि हाँ मैं बहुत अच्छा दिख रहा हूँ, तो दैट इज द बिगेस्ट अचीवमेंट ऑफ एनी सर्जन. सो वो हमें मिलता है जब हम ऐसा करते हैं. तो सो दिस इज द
Sir,
इम्पोर्टेंट.
sir, I mean, we are really fortunate to having you today, and more especially, you are not talking about technicality, this can happen, that can happen. You are sharing their real life stories, and these days, due to social media and everything, people are much more interested in real life stories than conventional procedure. कि ये करेंगे तो ये हो जाएगा और वो करेंगे तो वो हो जाएगा, like that. So thank you very much. Now, sort of one more question. How do you
हाँ,
how do you define a patient is um, having a more suitable option of robotic surgery as against conventional surgery? So how can you define the treatment protocol? This patient is good for robotic surgery and this patient is not good for robotic surgery.
I tell you, this is very good question, but the extent of disease is one parameter. आपका डिजीज कितना बड़ा है. So initially we were little bit conservative or defensive. So पहले हम when we started हम free flaps नहीं करते थे. Then we took it as a challenge. And ऐसा नहीं है कि we are the only one who are doing this. इंडिया में और जगह भी हो रहा है, दिल्ली में भी हो रहा है, ओवरसीज तो काफी होता है. So we learned from them and we took it as a challenge. Let's do it. So then now we are expanding. So 3 years back, what we are not doing with robotic, now we are doing. So, but still, I must say, the amount of disease or extent of disease is one parameter. Second parameter for oropharyngeal surgeries is mouth opening. पेशेंट का मुंह कितना खुलता है. अगर पेशेंट का मुंह नहीं खुलता है तो वो फिर देन 3 आर्म मुंह के अंदर जाना, दैट इज वेरी डिफिकल्ट टास्क. सो इट इज कॉन्ट्राइंडिकेशन फॉर रोबोटिक ओरोफेरेंजियल सर्जरीज. सो माउथ ओपनिंग इज वन पैरामीटर. समटाइम्स आपका नेक कैसा है, नेक पतला है, लंबा है, देन वी हैव इजी टास्क. एंड इफ शॉर्ट नेक, so then the task is tougher. So all these are relative things, but whatever contraindication today will not be contraindication tomorrow. So but still thyroid अगर हम करते हैं, thyroid की बात करें तो small nodule are good candidates. Bigger nodes, bigger thyroids are not good option for robotic surgery. So again यहाँ भी वही है, early stage, so the results will be better. अच्छा, मैं एक और आपको स्टोरी बताता हूँ. ये आप पहले पूछे, आपके दिमाग में जो है, देन आई विल टेल यू.
नहीं नहीं सर, आप कंटिन्यू करो, बाद में मैं आपको पूछूंगा. प्लीज यू कंटिन्यू.
कुछ this is 1 year back. So again I had patient, and she was of thyroid with a small nodule. Again the concern was same, young female patient, and the concern was same, skin पे scar नहीं चाहिए. The young girl, beautiful girl, aspiring model. So how can you spoil her career? And the only reason for not doing surgery, but she was diagnosed earlier, 3-4 months back, but she was avoiding the surgery. And the reason was scar.
सर एक मिनट, वैशाली किसी का जरा बैकग्राउंड में आवाज आता है. आई वुड लाइक टू नो you're the person, we don't want background voice. Yeah, sir, carry on.
So again the issue was scar, and that girl was not into the surgery because of scar. So then she came to me, and then we assured her, ma'am, you will not have scar after surgery. And we did. And
Well,
surgery went well, and she was happy.
excellent.
These are the things. These are the things.
Sir,
So
one
scar,
more.
initially at the beginning of my career as a head and neck surgeon, I was not very much keen to preserve the scar and cosmesis and all. But after 4 or 5 years of doing same surgery, same open surgery, then I realized what patient expects. A 70-year-old male patient or 65-year-old farmer may not bother about scar or teeth or bone or contour of the face or aesthetics. But a 35-year-old male singer, dancer, actor. You cannot give a scar on their face and spoil their career.
Absolutely.
And
Absolutely.
and so this is the difference. So obviously, scar plays a role, a very big role. If you read the psychology of the patient, there are a lot of literature. Scar plays a very emotional or role in the patient's uh, mental status. So that way, we are also giving them a mental peace.
Right. Sir, earlier you mentioned about treating laryngeal cancer. Is it possible, particularly while treating laryngeal cancer through robotic surgery, that the tracheostomy can be avoided, or it's not possible to avoid tracheostomy?
But this is the laryngeal surgeries with the robot is in infancy. Actually, it is developing branch. In few centers of the world, they are doing it, but for early lesions. So I'm not saying that all tracheostomies can be avoided with the use of robot, but still, what we are expanding, we are developing, we are learning, and a day will come where when there are more number of laryngeal lesions can be dealt with the robot efficiently. But still, I must say it is in infancy.
Right,
But
right.
laser has very good role. Laser transoral laser surgeries has got very good role in early lesions of larynx. So in those cases, we can avoid all the tracheostomies and radiations and all side effects of radiations.
Sir, I still have one more question. Uh, what are the possibilities? What are the possibilities of a recurrent cancer when robotic surgery is done?
Can you repeat the question, sir?
I said, what are the possibilities of recurrent cancer after a robotic kidney cancer surgery?
No, it is same as open. The recovery prognosis, all things are same. As I said, this is instrument only.
Okay,
So
yeah,
the recovery is same, prognosis is same, everything is same. So you can say it is good as open surgery, but the advantage is scar precision.
yeah, I think the last word you mentioned, precision, that is very important. I mean, everyone these days, due to technology and everything apart from cosmesis, having precision surgery, that is most required option for anyone. So I think that can help. Now, still one more question. With the robotic surgery, how deep you can perform the surgery, because you can enlarge you can see the organs tissue. I mean, much larger than normal conventional surgery. So how deeply you can perform surgery in case of robotic?
Shani bhai, please repeat.
I said, uh, due to, I mean, in case of robotic surgery, you can see organs, tissues, everything in a much magnified, as a
Yes.
magnified image. So how deeply you can perform the surgery to remove tissues, so that I mean, at times the radiotherapy can be avoided through robotic surgery.
No. It is in oropharynx we can avoid in early lesions of oropharynx. जैसे बेस टंग हुआ, हमारा टॉन्सिल हुआ, इन सब में पहले क्या होता था कि हमें रेडिएशन देना पड़ता था. We didn't have any choice. हमें रेडिएशन देना ही है। अगर टॉन्सिल का कैंसर है तो आपको रेडिएशन देना पड़ेगा। और रेडिएशन की साइड इफेक्ट्स, देयर आर लॉट ऑफ साइड इफेक्ट्स ऑफ रेडिएशन। समटाइम्स वी नीड टू ऐड कीमो टू द रेडिएशन, that again aggravates the side effects. But right now with the advent of robot, what happened is oropharyngeal surgery हम कर सकते हैं and we can avoid the radiation. जैसे कोई बहुत छोटा लीजन है जीभ के पीछे के भाग में, तो पहले वहां रेडिएशन देना ही पड़ता था, लेकिन अब उसे सर्जरी कर सकते हो। पेशेंट 5 से 6 दिन में घर जा सकता है, महीने भर में अच्छे से खा पी सकता है और उसे कोई साइड इफेक्ट भी नहीं होंगे। अच्छा, एक और खास बात है, ओरोफेरिंजियल सर्जरी या लेरेंजियल सर्जरी में जब भी आप रेडिएशन देते हो, तो रेडिएशन के बाद अगर रिकरेंस होता है तो हमारे पास रेडिएशन तो हम दोबारा नहीं दे सकते, वो तो एक बात हो गई। लेकिन हम सर्जरी दोबारा करने जाएंगे तो वो भी डिजास्टर होगा। द सर्जरी इन रेडिएटेड फील्ड इज वेरी 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 टफ। बट बिलीव मी, इफ यू हैव अंडरवेंट वन रोबोटिक सर्जरी, से कि आपको एक बार टॉन्सिल का ऑपरेशन हुआ है रोबोट से, उसके बाद में फिर से रिकरेंस आया है, तो देन यू कैन अगेन डू द सर्जरी। सो दिस इज वन एडवांटेज कि हम रिकरेंस को भी मैनेज कर सकते हैं। जैसे लैरिंग्स में है, सो अगर किसी को लैरिंग्स का छोटा सा अर्ली लीजन है, T1 लीजन है, उसको लेजर सर्जरी किया गया, फिर से हुआ, तो हम वापस लेजर सर्जरी कर सकते हैं, हम 2 बार 3 बार कर सकते हैं। लेकिन एक बार रेडिएशन दिया तो फिर दोबारा रेडिएशन इज वेरी डिफिकल्ट। दिस इज द एडवांटेज।
Right. Sir, that is one question from Priya Parmar. She is operation head of ICS Delhi. She is asking, like, doctor, can we do robotic surgery with the doctor sitting in one place and patient somewhere else? So, it is a kind of a daily robotic surgery.
हेलो रिया, सो वेरी नाइस क्वेश्चन। हाँ, ऐसा हो सकता है, अभी भी ऐसा ही होता है, बट राइट नाउ अभी कैसा होता है कि हम रोबोट भी सेम रूम में होता है और सर्जरी भी वही होती है। बट यस, इट इज पॉसिबल, इट इज पॉसिबल।
Great.
राइट नाउ
Uh,
people are not doing this, but technically this is possible.
Right, right. Sir, I have one question. I mean, this is what I mean, experience. I mean, while interacting with the caregiver, a lady, she had cancer of buccal because she was given chemotherapy. And now, after giving the chemotherapy, now, the medical oncologist said that, now she has to undergo the surgery or other surgical procedure. So
Yes, yes.
what I want to ask, particularly in the best interest of the patients and caregivers, that, in case of buccal etc., what is a better option, like going first for the surgery or going first for the chemotherapy and then surgery? Because, in this case, I have seen that, she is having a recurrent cancer, and now doctor said that, you don't have a choice and you have to undergo surgery. So what should be the ideal treatment protocol, first chemo or first surgery?
So Shrenik, it depends. Again, the extent of disease is the determinant whether we are giving chemo first or whether we are doing surgery first. If the extent of disease is very large, then in those cases we advise them 3 cycles of chemotherapy. We assess the patient before every cycle and then operate. If at any point of time we feels that the disease is not responding to the chemo, we change the therapy or we do the surgery right away. So there is in cavity, oral cavity particular, surgery is first choice for any given squamous cell carcinoma. No doubt about that. But if the disease is very large, in those cases only we advise chemotherapy. So for a small buccal mucosa, no need to think about anything else. You do the surgery. For if there is very big, large buccal mucosa, if there is very big, large tongue lesion, so we think about neoadjuvant chemotherapy. We downstage the disease and then we operate, and the results are excellent. So
Right.
it is just tailor-made approach for uh, each and every patient.
Right. In any case, in case of recurrent cancer, particularly in buccal mucosa, one has to necessarily, or rather essentially, has to underwent the surgery. That is what you are saying.
I'm saying it is a tailor-made approach. Every patient is different, every disease is different. So it has to be the treatment plan is to be customized. And that is why every big center has tumor board. So every new case has to pass through the tumor board. So tumor board is a committee where radiation oncologist, medical oncologist, and surgical oncologist sits together. They discuss each and every case and draft a protocol for the every patient. Say if a new patient come to me for buccal mucosa cancer, I'm not going to operate that patient right away. The first that case will be discussed in tumor board. Tumor board creates a treatment plan, and then that plan we will follow. So this is how it is to be. Then only patient gets best treatment. Then only the treatment is justified.
Right. For kind information of all audience. Every single individuals and whoever is going to watch this session. Let me tell you. This is what I've seen, particularly in private hospitals. I'm not much aware about public hospitals, but I think there must be some arrangement there as well. But tumor board is a very important platform where every single cancer patient, his or her history is discussed thoroughly, and then they are taking collective decision. Whatever the best option is available for the early recovery and treating cancer. So I certainly agree with what you have explained, Dr. Nitin, about tumor board.
Absolutely, absolutely.
Sir, there is one more question from Priya Parmar about patients' fear about disfigurement.
Sorry.
Pa- Patients, patients' fear about disfigurement. Patients' fear, मतलब जो
Okay. So this is so Riaz is asking me disfigurement. So
yeah, yeah,
this this robotics is all about preserving the aesthetics. These surgeries all about preventing disfigurement. So what we do these days, if you have to remove the bone, jawbone, we replace that bone from the bone from taken from the foot. If patient has to lose his tongue, we create new tongue from the tissue taken from hand or leg. If patient has to lose his teeth, there are implants. And upon that, we are hiding the scar. So facial, this is all about preventing robotic surgeries, functional outcomes, free flaps, all are just to prevent facial disfigurement and to provide patient a functional rehabilitation. So right now you can see an operated patient of jaw having intact jawbone along with the teeth implanted, and he is perfectly fine.
Fantastic.
So there is no disfigurement these days in selected cases at selected centers.
Right, right. Sir, one of the attendees, Sangeeta Malhotra, she said, okay, thank you, Dr. Sharma, for very informative talk, explained very simply. So, it's, same,
Thank you.
Sangeeta ji, see, we are doing our best. We are doing, see, in this show that is Friday's Page Training, we are bringing in competitive experience, knowledgeable, and trust me, down towards oncologists, be it surgical oncologists, medical, clinical, or radiation oncologists. We are choosing the right, right individual, right expert to come on our platform so that I mean you guys can never get misled and things I mean complex details, complex informations can be shared with the public in a very simple manner so that I mean you will be able to take appropriate decision yeah, as and when required.
Shrenik sir, I want to share few things. So these are not
Yes,
directly related to robotic surgeries, but these are a few things about awareness for oral cancers.
yes, sir.
तो दो तीन बातें मैं शेयर करना चाहूंगा. एक तो फर्स्ट ऑफ ऑल वी हैव अ मिथ that after biopsy disease spreads. Every day this came to me as a question from relatives or from patients कि सर बायोप्सी लेने के बाद ये वापस ज्यादा फैलेगा या इसको हम नहीं छेड़ें तो ठीक रहेगा, पर ऐसा नहीं है. ये दिस इज टोटली अ मिथ. बायोप्सी के बिना आपका कैंसर का ट्रीटमेंट शुरू नहीं हो सकता है, और बायोप्सी लेने से कभी आपका डिजीज फैलने वाला नहीं है. तो अगर आपके आसपास कोई भी ऐसा पेशेंट है जो बायोप्सी से डर रहा है, तो encourage him to get biopsy done and start treatment early as possible. Second thing, the earlier is better. अब मैं आपको सिंपल सी मैथमेटिक्स बताता हूं. We all know that we have 4 stages of cancer, 1, 2, 3 and 4. Everyone knows. अब इन 4 stages की सिग्निफिकेंस क्या है? अगर मैं स्टेज 1 के, ध्यान से सुनिएगा, स्टेज 1 के 100 पेशेंट ऑपरेट करता हूं, तो उनमें से 85% पेशेंट, मतलब 85 पेशेंट्स को वापस बीमारी नहीं होगी. 85 इज बिग नंबर. सिर्फ 15 को वापस होगी. और स्टेज 2 में देखें तो ये 25 को वापस होगी, 75 ठीक होंगे. स्टेज 3 में 65 विल बी क्योर्ड, 35 विल गेट द डिजीज, एंड स्टेज 4 में 45 to 55% of patient will get the disease again. So think about the remainder. In stage 1, 85 will be cured. In stage 2, 75 will be cured. In stage 3, 65 will be cured. And even in stage 4, we can save nearly 50% of the patients. तो कैंसर अब वो नहीं रहा पुराना जो 30 साल 30 40 साल 50 साल पहले था। ओरल कैंसर बहुत एडवांसमेंट हुए हैं एंड वी आर एबल टू सेव द लाइव्स ऑफ द पेशेंट। सो जितना जल्दी हो सके कैंसर का ट्रीटमेंट स्टार्ट कीजिए। एंड वन मोर थिंग, देर इज नो अदर वे। देर आर सम अनफॉर्चुनेट पीपल हु स्टार्ट्स alternative therapy. I am not saying that alternate what is the rationale and how it works. I am not an expert. उनका भी अपना काम है, वो भी करते होंगे, बट एलोपैथी में बिल्कुल रैशनल ट्रीटमेंट अवेलेबल है, तो आप इसको नेग्लेक्ट ना करें। आप
जी
ऑल्टरनेटिव
जी
मेडिसिन भी लें, पर एलोपैथिक मेडिसिन जो मेन स्ट्रीम मेडिसिन है हमारे कंट्री का, उसको नजरअंदाज ना करें और अपने ट्रीटमेंट को डिले ना करें। दीज टू आर माय मैसेजेस फॉर टुडे टू आवर ऑडियंस। देर ना करें, ट्रीटमेंट स्टार्ट करें। एंड फेशियल डिसफिगरमेंट अब नहीं होता है। मोर देन 70% पेशेंट्स में हम सेम एस्थेटिक कॉस्मेटिक फंक्शनल आउटकम देते हैं जो सर्जरी के पहले था। Patients are very well in their social life, in their familial life, in their careers, doing excellent. You can see Shrenik sir, he is living example.
sir. I am someone. I am not. I won't be saying fortunate, but I would say I am super fortunate that I mean I am the best one of the best candidate for stage 4 vocal cord cancer survivor stage 4. So I mean in those days I was given 1 week to live with, and now this is my 28th year. So I mean kudos to the cancer surgeon, their skills and their expertise and so on. Sir, there is one more question from Priya, P-R-I-Y-A, Priya, that what are not eligible for head and neck cancer, head and neck robotic cancer surgery? I mean, what are not eligible for robotic head and neck
Okay,
cancer surgery?
okay, I tell you.
Who are not?
So
Sorry, that
first
was a
one,
typo error.
Yeah, yeah,
The
yeah, yeah.
question was actually who are not
Yeah,
eligible.
yeah. I got it, but I was not willing to change the format you sent as a text. So go on.
so I am to answer what are who are not eligible.
Yes,
So in oral cancers, if cancer is going beyond your this zygoma, so those candidates are not good. Small lesions, tongue, buccal mucosa are very well eligible. But in these cases, the cancer will be removed intraorally by naked eye, but we can do neck dissection robotically, right? Second thing, in thyroids, bigger thyroids where we require neck dissections, big nodules, big cancers are not eligible for robotic surgery. इफ यू टॉक अबाउट ओरोफेरिंग्स, जिसमें जीभ के पीछे का हिस्सा, टॉन्सिल, पोस्टीरियर फेरेंजियल वॉल, वो सब आते हैं। सो इफ द पेशेंट हैज माउथ ओपनिंग, रिड्यूस्ड माउथ ओपनिंग, जिन पेशेंट्स का मुंह नहीं खुलता है, दोज आर नॉट एलिजिबल। एंड ऑफ कोर्स बिगर लीजन्स ऑफ ओरोफेरिंग्स आर नॉट गुड कैंडिडेट्स फॉर robotic surgeries. So we need to define the criteria. We need to select the patients whom we can perform robotic surgeries and we can give them good outcome. So case selection is very important.
sir. Such selections are being decided in the tumor board, or these are kind of independent decision taken by
It depends.
dedicated
It depends. It is. It depends upon team of surgeons who are doing it, how experienced they are. Because this is the. Matlab, everyone is learning.
right,
So
right,
definitely, team of surgeons who are going to perform the surgeries, if they are confident, if their setup is good, if they have backup, if they are very good in open surgeries as well. So to perform robotic surgeries, you need to be first. You need to be expert in open surgery, because
absolutely,
whenever we do the robotic surgery, we take the consent that in 1 or 2% cases we may not complete the surgery robotically, and then we may need to open. So first you need to become expert in open surgery, then you can step up.
right, right. I agree. And sir, one more question. Uh, as compared to open surgery, the duration of the surgery in robotic, the time is less, same or more.
No, no, it's more, definitely more. So but again, it is a learning curve. uh, Initially you take 2 to 3 hours more, then the time come down, but it is more than open surgery, but
Right.
that is justified. And after seeing the results, you feel that it's okay to be little late, or longer duration of surgery is justified after seeing the results.
Sir, I have one request. This is rather my thought, but I'm requesting on behalf of the global audience that we would prefer and we would like to speak to your management to reduce the cost of robotic surgery to whatever best extent possible. I know.
Yes, 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 yes,
You cannot.
definitely, definitely. It is in our mind also. And the cost of the surgery definitely will come down. There are certain logical reasons for this. Right now, we have Indian company came with a robot. There will be more robots will come into the market. Competition will rise, so the cost will come down. This is one factor. Second factor will be, right now the availability of robots are very limited. Only few centers across the country has got the facility. But with the time, there will be more robots available. The parts will be cheaper. There will be more robotic surgeons. So each and every patient from even small towns will have access to these surgeries. Then definitely the uh, cost of the surgery will be less. Soon this will come into the insurance also. Right now, insurance companies are not paying for this, but in certain cases they have started paying. So eventually, head and neck will also come fall into that category. Also, the insurance agencies or insurance companies will take care of the finances. So I can assure you, the cost will come down. Access will be easy. Will be more. More surgeons will be there, and robotics will be the standard of the care फॉर हेड एंड नेक सर्जरीज. अगर हम आज से 6, 7 या 5 साल के बाद हम वापस इस प्लेटफॉर्म पे मिले, तो मैं आपको बताऊंगा कि देखिए सर्जरी की कॉस्ट भी कम हो गई है. अभी हम लोग ज्यादा ज्यादा जगह पे ये सर्जरी हो रही है. और शायद वो भी होगा जो हमसे पूछा था कि कोई कहीं बाहर बैठा है और सर्जरी कहीं दूर हो रही है. तो
Right.
डेफिनेटली.
Yeah, so my idea is very simple. Like if this can be made more affordable, then people will not hesitate. People will not hesitate for opting robotic surgery as against the open surgery. That is what my concern is, and you very rightly said that time will come. then things will improve to greater extent.
बिल्कुल.
Vaishali, please check if there are any questions or etc. Otherwise, we'll conclude today's session and we'll express our deepest gratitude to Dr. Nitin Sharma sir for explaining entire session in a very lucid manner, very simple and easy to understand approach.
Sir, there is no more questions on Facebook. And Dr. Nitin, it was a great session. Really, the stories of the patients, and it was quite inspiring, the entire session. Thank you so much, Doctor.
Thank you. Thank you. Thank you.
I would like to mention to Priya Parmar that I believe the responsibility or assignment given to me as a moderator is rather justified to some extent. That is what I am feeling. But anyway, I will look for compliments at the later stage. So, Dr. Nitin sir, thank you very much for your valued time explaining everything black and white. ये कलर का जमाना है लेकिन you explain everything in a black and white like Raj Kapoor's movie कि सबको पसंद आ जाए सब everybody would be getting enough advantage and and more people will opt for robotic surgery if they qualify.
Thank you, Shrenik bhai. Thank you, Vaishali. And thank you all, entire team, for inviting me.
And by the way, let me mention to who is let me mention that next Friday, next Friday, Nathan said for your information, next Friday we are having breast cancer surgeon Dr. D.G. Vijay on our platform,
Very,
and he will be sharing.
very.
He's a equally good friend of mine, and he will be sharing his years of experience, and particularly is more important for the female community because it's all about going to be all about breast cancer surgery and treatment.
So that will be great session. I'm sure.
Thank you. Thank you. Sir,
God
thank you.
bless you guys. You are doing excellent work spreading awareness about cancer. Wish you all the luck. कभी भी कोई भी काम हो, just give me a call. I'm just a call away. Thank
Sir,
you.
sir, wait, I've got magic. Wait, I've got magic, which I have seen for last more than 10 years. And that more, we were having kind of a privilege to have you on our platform and that too on a very short notice, 24 hours के अंदर आप इधर आ गए platform पर, that is more than enough for us and especially for Indian Cancer Society Delhi branch. So thank you so very much and thank you audience for your graceful presence and to join us on next Friday at 6 p.m. Thank you.
Thank you, sir. Thank you, Doctor.
Thank you. Thank you.